Welcome back and thanks for your time. As you know, we talk about pain. Today we'll be discussing chronic post-surgical pain. Pain that persists for months, sometimes years after a surgical operation. If you give me a few minutes, what I'd like to do is I'd like to talk to you about the top 6 surgeries that can trigger this most devastating neuropathic pain condition, number 1. Number 2, if you're about to have one of these surgeries or might have one of these surgeries, and a lot of us are going to have some of these surgeries in our lifetimes, I'd like to share with you ways to go about preventing chronic post-surgical pain from happening. And if you're unfortunate to have chronic post-surgical pain or are suffering, I'd like to share with you ways for you to go about getting the right treatment, and importantly, one of the most important things you can do to get the right treatment. So let's dive in. As a medical doctor of more than 25 years experience and 20 of those years assessing, managing and treating pain, and part of that time being an anesthetist, I know a few things. And number 1, surgery can be painful. It doesn't have to be painful, don't get me wrong, but surgery on the whole can be painful. That's another discussion. Surgery doesn't have to be painful. But number 2, pain persisting after surgery, after the tissue healing process, is not okay. It should not happen. If you're watching this, either yourself or somebody you love or know is suffering from some form of chronic pain, probably pain related to a surgery, and they're suffering, they're struggling, they're lost, they're alone, they don't know what to do, and you feel helpless as well. So I hope that I can give you some information, because if you have information about pain and your body, you have knowledge, and the moment you have knowledge, you feel like you're back in the driving seat again. And if you're back in the driving seat again, you can get on with your life, or make it so that you can find that path to get on with your life. Right, a couple of things. Firstly, the prevalence of chronic post-surgical pain. The question you're going to be asking is does this matter? Absolutely it matters. The statistics, the numbers are that roughly globally, around about 230 million surgical procedures are performed every year. That is a big number. Globally, the average for persistent pain after surgery, chronic post-surgical pain, roughly 20 to 30% of all surgeries across the board. Now, some surgeries are more likely to trigger chronic pain than others, but on the whole, 20 to 30%. Those numbers are staggering. Are the number of operations that we're having per year going up? Yes. Why? We're living longer. Medicine, surgical techniques are becoming better. Imaging and scans are becoming better. We are becoming unhealthier as nations. We are more overweight. We have more inflammatory diseases. So for these reasons, the risk of chronic post-surgical pain is only going up. And that is a big worry. It is a big factor. And that's partly one of the reasons why, as time goes on, we'll dive into chronic post-surgical pain in a lot more detail, but today it's just a broad overview. Let's move on. Now remember, whatever I talk to you about, whatever pictures I show you, these come from published scientific papers. So I will share with you the links to some of these papers and some of these pictures that I might show you, so that you can go and have a read for yourself. And I will also share with you some links of other videos that we've done that might be of relevance. Notably, one for this to complement this video is neuropathic pain and neuropathic pain treatments. Let's move on to risk factors for developing chronic post-surgical pain, because some of us are at risk. Some of you are at risk. Who's at risk? That's what you might ask. Am I at risk? How do I know if I'm at risk? Well, there are many studies and papers that have been published trying to define the risks for who might develop chronic post-surgical pain. And of course, if we know who might develop it, perhaps we can step in, prevent it, perhaps we can step in and treat it early. So let's go through some of the risk factors, and you might look at risk factors in different ways. There is this diagram published from a paper that defines risk factors into 3 groups: patient risk factors, anesthetic risk factors, surgical risk factors, and pain risk factors. Now, the inner circle is more scientifically guided. The outer circle, there's slightly less scientific evidence for it, but these are just some of the things that keep on cropping up. This is not set in stone. These are possible risk factors. Now, before I dive into those risk factors, there are 3 massive risk factors for developing chronic post-surgical pain in my experience dealing with this year on, year out. Number 1, severe pain before surgery. If you're suffering from pain and you're about to have a surgery, you are at risk of developing chronic pain following surgery. If you have chronic pain to start with before surgery, you are at risk of new, different pain after that surgery. Number 1. Number 2, if you have acute, severe post-operative pain, in other words, you've had the surgery and the pain after the surgery is severe, immediately after the surgery is severe, you are at risk of developing long-standing pain. It's not to say it's going to happen, you're at risk. And the third P is those that are psychologically vulnerable. We know that people that have pre-existing anxiety, pre-existing depression, pre-existing mental health troubles, struggles, you're more at risk of developing chronic post-surgical pain. Those are the big 3 Ps in my experience. But there are others, so let's go through a couple of them in turn. Let's focus on the surgery. What surgeries put you at risk? Well, I'll mention the surgeries in a second, but I'll mention the type of surgery in a second, but what about the surgery itself? Well, if the surgery is longer, you're more likely to have tissue trauma, tissue damage over a longer period. The risk is a bit higher. If the surgery has complications, hematoma, bleeding, infection, and you require further surgery, reoperation, the risk of chronic pain goes up. The surgical procedure itself can put you at risk, and I'll share some of those in a second. Nerve injury is a big trigger for chronic post-surgical pain, and some surgeries are more likely to trigger nerve injury just by definition of the type of surgery that it is. Some might say that if you're having an open surgery or laparoscopic surgery, the risk is higher or lower. We're not really sure on this. Laparoscopic surgery is keyhole surgery, and some say, well, if you're having keyhole surgery, it's less traumatizing to the tissue. Yes, it is. It's less traumatizing to the, just call it abdominal wall, but the surgery itself that happens on the inside is still the same. Taking out a kidney, it's still the same. Taking out a pancreas, it's still the same. Taking out part of the bowel, it's still the same. So whilst keyhole surgery might reduce some of the risks, it doesn't necessarily reduce the risk completely. If you've got cancer and had cancer surgery and associated with chemotherapy, radiotherapy, that risk goes up because it's further tissue damage. So there are some factors on the surgery that can put you at risk of getting chronic post-surgical pain. What about patient factors? What about your factors? Well, there are some factors, and again, this is just what some of the science has suggested. Pre-existing pain, post-operative pain, psychological vulnerability, anxiety, depression. Some say that if you smoke, you're at slightly higher risk of developing post-operative chronic pain. Some say that if you have medical illness, comorbidity, you're more likely at risk of getting post-operative pain. Disabilities, diabetes, inflammatory medical conditions, you're more likely to develop post-operative pain. Some say that the younger the person is having a surgery, the more at risk they might be of tissue injury. I'm not sure if I agree with that one, but that's what some of the studies show. And there are some other studies as well, or some other factors. Genetics may play a role. We don't know a lot about it, but it can and tends to occur in families. We know that the female sex is more likely to develop chronic pain than the male, and that's another discussion completely. We know that females tend to have slightly more chronic pain than males. Is it because they volunteer chronic pain? Is it because their hormonal milieu is different to males? There are many factors we don't know, but we do know there is slightly more females with males in chronic pain. And in our clinic here, we know that about 55 to 60% of the patients we treat are females. It's just across the board. We just don't know why exactly. We know that high body mass index can put you at risk of developing post-surgical pain, again, for many reasons. So that's surgery factors, patient factors. And then the other one is pain, of course. And we know that pre-existing pain, chronic pain, neuropathic pain, previous pain conditions like complex regional pain syndrome, hypersensitivity, sensitization, which we'll come to, and of course acute postoperative pain can put you at risk of developing chronic pain. Anesthetic factors, we're not sure about whether the way the anesthetic is delivered can prevent or not chronic post-surgical pain. I believe it can and does, which we'll come to in the prevention part of this discussion. But we'll touch on that a little later. Now, if you have any questions about risk factors, please put them in the comments below. We're here to answer your questions. We are here to have a dialogue and a discussion. Let's move on. The top 6 surgeries to trigger neuropathic pain, chronic post-surgical pain. Number 1, you're probably aware of this already, but amputation of a part of the body, because that surgery just cuts through nerves and injures nerves. Number 1, whatever nerve that is. And it doesn't have to be a hand or a foot or a leg or an arm. It can be another part of your body, gallbladder, eye, skin, burns. So amputation of part of the body can trigger pain. It doesn't have to be a limb. It can be another part of your body that you get that is taken away. Number 2, mastectomy. Oh, sorry, let me go back to number 1, amputation. The odds are about 30 to 85% of amputations can have chronic post-surgical pain. On just call it 50% of surgery, so 1 in 2 is going to develop chronic pain. That number is high, but we can anticipate it because it's that type of a surgery. Number 2, mastectomy. The odds of developing chronic post-surgical pain are roughly between about 11 and 50%, so just call it 40%. That's more than a third. That's more than 1 in 3 of these surgeries, these mastectomies, that can trigger chronic pain. And why? Because of where the surgery is, you're traumatizing nerves that branch off from the brachial plexus. One of those nerves is the intercostobrachial nerve, and there are other nerves that can be traumatized. The surgery is not done incorrectly or badly. It just traumatizes tissue and nerves. That's number 2. Number 3, thoracotomy, operation into the chest wall, spreading the ribs out. And we know that under each rib there lies what we call a neurovascular bundle of artery, vein, and yes, you said it, nerve. And that's called the intercostal nerve. So trauma to the intercostal nerve at thoracotomy can trigger post-thoracotomy chronic pain. And the number is about 5 to 65%. So again, just call it 40%. That's a high number. Number 4, inguinal hernia surgery. This is such a common surgery. Having a hernia repair down in the inguinal region gives you about a 5 to 60% chance, depending on the study you're looking at. Call it 30%. Call it 1 in 3 hernia surgeries can lead to persistent pain at 1 year. And that's because of injury to the ilioinguinal nerve, the iliohypogastric nerve, and sometimes the genitofemoral nerve, because the nerves are in the area that the operation needs to occur. Number 5, spinal surgery. Call it 8 to 40% of all spinal surgeries can trigger some form of ongoing pain. Call it 30%, call it 1 in 3. I think the number is probably a little higher, but I'm going by the evidence. 1 in 3 spinal surgeries can trigger pain. Why? Because the spinal area protects the spinal cord. It protects some of the most delicate nerves. It protects the spinal cord. It protects the nerve roots. It protects some of the peripheral nerves. There are nerves that lie on the body of the vertebra, not even inside the vertebral canal. So it's a nerve-rich area. And a lot of these nerves can be traumatized either by the surgery, by inflammation, or by scarring. And we'll talk about chronic post-surgical spinal surgery pain at another discussion. And I'll do that one fairly quickly, so keep an eye on this channel. Number 6, total knee replacement. 13 to 44% of total knee replacements, according to the studies, can develop chronic post-surgical pain. Call it 20%, and again, joint replacements are going up for many reasons, which I've mentioned earlier. So the risk of chronic pain is going up, and it's damage, injury to the infrapatellar branch of the saphenous nerve. There are other nerves around as well. There are other genicular nerves, which we call them, but the big one is the infrapatellar branch of the saphenous nerve. So what I've showed you is that chronic post-surgical pain can happen. It's prevalent. It can happen with many surgeries, but there are the big six that I've talked to you about. Let's move on. Why do you get chronic post-surgical pain? Because if you know why, we can treat it or we can understand it a bit better. Right, let's break this down from the peripheral part of the spinal cord all the way up to the central part of the spinal cord and the brain. So from the finger all the way up to the brain, things can happen along the pain pathway. So firstly, when you cut a nerve, that nerve ending that is now separated from the body becomes hypersensitized, becomes inflamed, and that can trigger some forms of pain. The end of the nerve that is cut develops what we call a neuroma, and that is an erratic clump of nerve tissue that grows around the end of the nerve. And that clump of nerve tissue can work differently. It looks different and it functions differently, and it becomes more sensitive, and it can trigger unnecessary neuropathic pain. If you go to the dorsal root ganglion, at the dorsal root ganglion level, gene expression changes. So the genes within the nerve fibers change. They switch on, they upregulate, they overdo it. They overgrow chemical inflammatory transmitters, which causes excessive nerve activity. You can get some changes within the back of the spinal cord, the so-called dorsal horn of the spinal cord, which is a relay center. And what you have is you have upregulation of all these relay signals, and they start firing erratically, if I could use that as a term. The chemical transmitters go up, all the inflammatory pro-nociceptive ligands and transmitters become activated, so you feel pain when you shouldn't. Not only that, but at the dorsal horn, this relay station, there are relays that actually turn pain signals off, because your body's always turning pain off, even though you are feeling pain, and the relay signals that turn pain off disappear. And so there is no gate to stop pain from traveling up the spine, and so you get this influx of pain signals. There are some changes at the spinal cord level, as I've mentioned. There are some changes at the brainstem level as well. So the limbic system changes. The limbic system changes your mood, your behavior, your feelings around pain. And then from the limbic system, the base of the brain, to the cortex, there are heaps of changes that happen at that level as well. And so you can see how the physiological process of pain changes after tissue injury. Our ability to turn pain off switches off. These pain signals just rush into the nervous system, rush into the brain, and you get this excessive pain. You get this excessive hypersensitivity. What this is called is sensitization, which is, in a sentence, the amplification of nociception. It's the amplification of the pain signal. We'll talk about that in another discussion, but you become sensitized. So let's move on. We've discussed that chronic pain is prevalent. We've discussed when it's most likely to occur, who's likely to get it, and we've discussed why it might happen. What do you do about it? There are two ways of looking at this. Number one, if you might have one of these surgeries, how can you go about preventing it? And number two, if you've got chronic post-surgical pain, what the heck can you do about it? Well, let's talk about prevention first. If you're about to have one of these surgeries, if you might have one of these surgeries, joint replacement, spinal surgery, hernia surgery, talk to your surgeon, talk to your anaesthetist. If you have a pain specialist and you've got pre-existing pain, talk to your pain specialist. Ask them what the likelihood is. Put them on the spot. Don't be afraid of this. Ask the surgeon, what's the likelihood of chronic post-surgical pain in your hands? What do you do to prevent chronic post-surgical pain in your experience? Can I please talk to my anaesthetist beforehand? Can I make sure that I have a plan to prevent chronic post-surgical pain from happening? Talk to your pain specialist as well. Let the pain specialist work with a surgeon. Let the pain specialist be your advocate. Pick up the phone, write a letter. I'm a little worried about Mr. or Mrs. X because they're about to have surgery. These are the things I suggest. Can we work together to make sure we get them through surgery really quickly, really easily, nice and smoothly with no problems? So there are things that you can do in the pre-operative phase to prevent this from happening. And I know I'm going to get on my high horse about this, and you might have heard me say this before, but every one of us can start preventing chronic post-surgical pain today by living your healthiest lifestyle. And that involves not smoking, not drinking or drinking moderately. That involves managing stress. That involves activities and exercise. That involves living an anti-inflammatory lifestyle, having a diet that reduces inflammation, more fresh fruit, more vegetables, more fish, more legumes. So the Mediterranean diet versus the Western diet. So these are things that we can all do right now to help prevent chronic post-surgical pain from happening. Manage your weight, manage your pain. Pre-existing pain can cause post-operative surgical persistent pain. So manage your pain well pre-operatively. If you're having surgery, see a pain specialist, work out a plan. So you're living your best life, you're managing your opioids before surgery, you're managing your pain well before surgery, you're talking to all the team before surgery. Perioperatively, around the time of surgery, this is when the anaesthetist should get involved. This is when the surgeon should get involved and the pain specialist. But what we can do perioperatively, and I firmly believe this, that regional techniques, so local anesthetic blocks, epidural anesthetics, spinal anesthetics, good local anesthetic nerve blocks can prevent chronic pain from happening. And studies have suggested this, studies have supported this. There's just a few things we're not sure about. But the bottom line is, if you're having an operation on a limb, you can have a nerve block, if appropriate, that might reduce the pain that you experience around the time of surgery and immediately after the surgery, which means the risk factor pain, is less. So you're less likely to have pain persisting. You're less likely to have sensitization. So talk to your anaesthetist. So for example, if you're having an inguinal hernia surgery, dear surgeon, dear anaesthetist, are you going to do an ilioinguinal nerve block beforehand? Are you going to do what we call a tap plane nerve block beforehand so that I don't experience pain when I'm anesthetized? Now, a lot of people are not aware of this, but when you're anesthetized, your brain is turned off, but the rest of your body still functions. Your body still reacts to pain if it's not treated well while you're anesthetized. The inflammatory response to pain, the inflammatory response to tissue trauma, which triggers pain, still happens. So you still have to actively prevent that from happening using a regional anesthetic technique or a good anesthetic technique. So regional anesthetic techniques are very important, in my opinion, and expertise. Sometimes ketamine infusions can help prevent neuropathic pain from happening. Different discussion. Sometimes lignocaine, lidocaine infusions can prevent this from happening as well. And the judicious use of perioperative opioids can be very helpful in controlling pain, which reduces the risk of persistent post-surgical pain. So there are things that can be done perioperatively to reduce the risk of post-surgical pain. And then post-operatively, if you have acute severe post-operative pain, what's the treatment? Get it treated urgently, get it treated aggressively. Make sure the surgeon calls in a pain specialist, make sure the surgeon calls in a physician, make sure the surgeon calls somebody in to support him or her to manage your acute severe post-operative pain. That is one of the most important things. And then when you get discharged, make sure there's a plan, whether it be the GP managing your pain, whether it be teeing up with your pain specialist again, whether it be going to a pain clinic to help them manage your medications. If you taper medications too quickly, pain might return and persist. If you leave medications on for too long post-operatively, further issues can happen with the medications. So There are things that can be done for you to prevent chronic post-surgical pain. I forgot to mention one: manage stress, manage anxiety, manage your mental health in the lead up to surgery, immediately post-operatively as well. Right, let's talk about treatment strategies. You've got chronic post-surgical pain. A family member's got chronic post-surgical pain. Someone you love's got chronic post-surgical pain. What do you do about it? The single most important thing to do if you've got chronic persistent post-surgical pain is get help. Don't do this alone. We love GPs, we love family physicians, but sometimes they're a little out of their depth when it comes to managing chronic post-surgical pain. See somebody that knows how to diagnose what's going on. See somebody that knows how to assess and manage chronic post-surgical pain. See somebody that's prepared to work with your surgeon. Now, clearly your surgeon's going to be important in this, because one of the important factors in chronic post-surgical pain is you've got to make sure that there's no complications. So cancers, recurrence, infections, hematomas. So it is important to make sure that the surgery, there is no immediate complication of the surgery or delayed complication of the surgery, absolutely. But if there's not, you've got to get pain. You've got to get treatment from a pain specialist or somebody that knows how to assess, manage, and treat chronic pain. That is the single most important thing that you can do. The same thing applies. There are 5 ways of managing chronic pain, and you'll see this in other videos. It applies to you following the type of surgery you've got. It'll be a different application of treatment following a knee replacement to a spinal operation, but the principle's still the same. Early treatment, multimodal treatment, not just a single treatment. Multimodal means lifestyle, stress management, weight management, movement, activities. Don't get stiff, don't get weak, don't get deconditioned, number 1. Number 2, work with the allied health team. Find a good allied health team. Find a good psychologist to manage stress. Being mindful can reduce stress. Fact. Reducing stress reduces pain. Fact. Mindfulness-based activities can help. Behavioral changes can help. So a psychologist might help you change your behavior at the pain. It hurts, don't move. That's going to cause stiffness, weakness, deconditioning, make things worse. So helping you to change, call it little habit changes, slowly and steadily. Good physiotherapy can help with kinesiophobia, which is fear of moving, lack of movement, deconditioning, getting stiff. It's important to overcome those things with, number 2, the allied health approach. Number 3, medications. There'll be a link to treating neuropathic pain where we discuss some medications that you can use. There are many medications that can be used to treat neuropathic pain. Better to use more than one medication because you're not using one in high dose, you're using a few in lower doses. Number 4, interventions. I'm an anesthetist. There are ways that you can target particular nerves to reduce pain and help recovery. Ilioinguinal nerve block, ilioinguinal nerve radiofrequency. If you've got ilioinguinal neuralgia following an inguinal hernia surgery. So depending on the surgery, depending on the pain, depending on what's going on, there are some things you can do with targeted nerve injections to diagnose, treat, help rehabilitate, get you from there, get you up to there. And then, of course, for severe refractory cases, number 5 is some forms of neuromodulation, neurostimulation, peripheral nerve stimulation, central spinal cord stimulation, intrathecal drug delivery. These are just terms I'm using. We'll elaborate on them at some point, but that's number 5 for severe refractory cases of chronic post-surgical pain. The evidence is present for some of these disease processes. The evidence is growing. We can change people's lives with some of these therapies. So what I've done is I've given you a bit of an overview on chronic post-surgical pain, why it happens, who can get it, what to do about it. If you have any questions, please just ask. We're here to educate. I want to understand what's going on with you, your life, those around you, and we can tailor our education to suit the people that are watching, number 1. And number 2, like, share, comment. Let's grow awareness, because as I've said before, there are way too many people suffering and struggling with chronic pain. Thanks for your time.